Welcome. This is the Minority Health Report with Dr. O. Today, I'm going to give a tip that is very simple, but is a solution that we can all use, especially for those of us that care for elderly loved ones or loved ones that have intellectual challenges. One of the main problems I deal with in primary care is medication adherence. What does that mean? Well, a lot of times for lots of reasons, patients forget to take their medicines like they should, and they come into the doctor's office and either the blood pressure is high or the diabetes is high or the pain is not going away and what have you. I will tell you that one of the main challenges I face is getting my patients to be consistent with their medications. And a simple solution I've come up with through the years, I'm going to share with you to simplify taking medications, what we call medication adherence. Okay, this works for everybody, but especially if you have elderly loved ones, parents, grandparents, uncles, and aunts. I'm going to give you an example of what I'm talking about here. This is a medication tray. It's a plastic. It divides out your medicines from Monday through Saturday, and you can use this to distribute out your loved ones' medicines across the week. Makes it easy to keep tabs and to follow. One thing that's important is if you don't live at home with mom or dad, grandma or grandpa, it's easy to come back in and say, hey, let me see what you've been doing with your medicines. You pick this up and you can track and see what medicines have been missed and what medicines are being taken. Okay, this is important. This is a reusable, refillable one, and depending on what pharmacy you work with, they can also pre-package your medicines in blister packs that do exactly the same thing. Okay, this service I use a pharmacy, a local pharmacy here in Charlotte. They're a small pharmacy. I don't know that the national chains will do this service for you, but it's one of the advantages of using a small pharmacy, the personal touch and little perks like this. The pharmacy that I use also can deliver to your house or your loved one's house. I have found this to be very useful for all patients. At Walmart or any store, it will cost between less than $15. I know for sure, less than $15. What I advise to do is get a tray that is at least 1 week across, and this one says morning, noon, evening, and bedtime. So depending on whether mom or dad is taking medicines twice a day, 3 times a day, you can distribute it out this way. For my pharmacy that I use for my patients, they actually send this pack to the patient and mark it week 1, week 2, week 3, week 4, so that when you come in, you can tell mom or grandma to start using week 1 and then go to week 2 and so on and so forth. I have found it to be a very useful tool for my elderly patients, and I highly recommend it. If you want to know more, you can visit us. I will drop my phone number down here, especially if you're in the Charlotte area. At Crown Clinic, these are some of the tools we use to make sure our patients get good outcomes. Okay, I hope you enjoy this. Tune in for more tips in the future.